Yesterday, I had to deal with a major injury during one of my parkour sessions. This video is going to be about what happened and how I dealt with it, as well as hopefully teaching you guys what to do in a similar situation. So I was running a birthday party and had about 10 young lads in, and we were trying a speed course on some of the equipment that we had outside. And within the last 10 minutes of the session, a young lad who's about 7 tripped, fell, and within a second hit his face on an obstacle in front of him and basically split his cheek open. Now, I've only had to deal with 2 major incidents like this within the 5 or so years I've been teaching, so it was scary. Fortunately though, he was absolutely fine and it was dealt with well and no one else was hurt. I'm going to be walking you through what I did, and I'm going to be following the Dr. ABC first aid guidance that comes from St. John's Ambulance, who are a really great organisation to get involved with if you want to get qualified in first aid. So the first thing, you need to assess the situation. Is anyone else in danger? Will you be in danger if you go and approach the casualty? When it happened, I wasn't in danger because there was nothing that could have affected me. It happened to one person. But you need to think about, if you're in a gym or if you're outdoors, you need to think about things which could be an issue, such as glass, or if there's any uncovered electrical wires which might be affecting the casualty. If there is a chance of infection, then you're going to have to protect yourself and the casualty. So sterile wipes and gloves are your best bet. Only approach and help the casualty if you know that you're going to be safe in doing so. As soon as it happened, I knew it was serious. So I needed to take charge, and as the head coach, I need to take responsibility for what happens next. There's other kids you've got to think about. You've got to get them away from this area, and I knew that I had to get them away from the scene as well, because there was blood, it was distressing, they're quite young, and you don't want them to be scarred mentally by what they're seeing. This is where your assistant coach can really come in handy. They can get all the kids away from the environment, somewhere safe, get them registered so that you know that no one else is in danger. When you see these things, it's distressing and there will be a sense of panic within you, but time is of the essence, especially if there is something that is majorly wrong with your casualty. So I had to act quickly and I had to go over and assess the child who was hurt. This is where the R comes in for the Dr. ABC, the response. I went over to the child. They were conscious, they were alert. I knew that they were in pain, but I knew that it wasn't a very serious injury. One of the most fundamental things you can do is make sure there is a calm atmosphere. You don't want to be relaying panic onto the child or the casualty, because that's going to make them feel much worse. So I was constantly reassuring this child. I was making sure that I was telling them that they were going to be okay, we'd get help, they'd get their parents. Now, if the child had hit their head and been knocked unconscious, then I would have had to test this by gently shaking their shoulders or even pinching their earlobe to check whether they are alert in any way. At this point, you need to know whether help is needed or not. So I knew that there was a big puncture wound on his face. It was bleeding quite heavily and I needed to call 999. But I guess I could have got away with calling 112, which is the non-emergency number. In the heat of the moment, I was worried, I was scared. I just called 999. Get the help as soon as possible, that's the most important thing. So the next letter is A for airway, and fortunately I didn't have to deal with this as it was just a surface injury. It wasn't anything to do with his breathing. But if there was an issue with breathing, so if there's choking for example, then you'd have to lean the child forward and give them 5 hard slaps on the back. And if this didn't work the first time, then you go again and you go again. If this doesn't work, then you have to use the Heimlich maneuver, where you place your hands over them like this and lean them over and squeeze their stomach here. So hopefully that can make the blockage come out. If the child was unresponsive, then you'd have to make sure that their airway is open. Okay, so you'd have to tilt their head back, make sure the mouth is open. This leads us on to B for breathing, and we're going to assume now that they are not breathing. But you need to check this. So you need to go back to the R, the response, and ask them, open your eyes, or use their name to try and prompt some sort of response. If you're not sure, you need to look for the chest movement, even put your cheek over their mouth and just feel for any breath coming onto your cheek there. If there's no response, then you know that they're not breathing and that you need to start CPR. So the first thing you have to do is give them 5 rescue breaths by placing your mouth and sealing it over their mouth, holding the nose. Do this 5 times and then you want to move on to compressions. You need to give 30 compressions, locking your fingers onto their chest, pumping hard. Then you want to do 2 rescue breaths and then 30 compressions, 2 rescue breaths, 30 compressions, and keep going for as long as you can or until help arrives. The last part of Dr. ABC is the C for circulation. So this is regarding the blood and whether there's any severe bleeding. Now yesterday, when all this happened, I didn't have to, thank God, think about anything to do with CPR or breathing. But I did have to think about circulation because there was a lot of bleeding from his face. The first thing we did was grab the first aid kit, get a bandage, apply pressure straight away. If there is something that's stuck within the wound, then do not move it because that could be a plug to stop further bleeding. What you need to do then is put pressure on either side of the wound and the object. Bandage is the best thing to use, obviously, and you should have a first aid kit. But if you don't, then any clothing will do so long as you can apply pressure and it's going to be relatively clean. Now, if the bleeding was more severe yesterday, I may have had to treat the casualty for shock, in which case you have to lie them down gently, make sure that their legs are raised above the heart level and constantly reassure them. The last part of dealing with a major injury is the aftermath. And what happens here is still really, really important, even if the casualty is okay and out of harm's way. Now, if you're a coach, then this is most likely going to be involving a child. So the parents will be involved and you're going to have to be completely honest and transparent about what's happened. You're going to have to maybe record an injury log specifically about the events that happened and the details of the injury. There's other kids about, so you're going to have to ensure that they get home safely and all the parents are notified about what's happened. It's likely that if there is a major injury, then this session will be cancelled straight away. I think this is a good idea because you need to ensure absolutely that nothing else is going to happen to any of your participants. Hopefully the casualty is okay and on their way to maybe the ambulance or the doctors. So if this is the case, then the best thing you can do is follow up with an email asking how they are or a phone call. You don't want to lose this child or this participant. You don't want it to have scarred them and put them off parkour forever. And this could be the case with the other kids as well, especially if for whatever reason they've seen what happened. It might really scare them, it might put them off parkour. So you need to make sure that you explain how rare these things are. You need to explain that life isn't completely guaranteed. You don't know what's going to happen. You can't get rid of risk completely. I've mentioned the importance of atmosphere before, and really this is so applicable to a major incident situation because the way you handle it and the way that you console the parents and the way that you speak to the children, the way you explain what happened can have a positive or negative effect on the mentality of all those people involved. And you want to promote a positive mentality for going forward and hoping that this won't happen again or that it's very, very rare for it to happen again. So I hope you found this video useful, guys, and I really hope that nothing befalls you like this, like what happened to me yesterday. It's not nice, but you've got to be prepared. You've got to understand what to do. You've got to be alert. You've got to be quick with your actions, and you've got to be effective. And that's part of the whole parkour mindset and something that I want to improve on. I want to constantly improve on. Check out St. John's Ambulance as well. They do brilliant first aid courses and they've got loads of stuff online. You can actually get free little first aid packs that you can carry around in your pocket, which actually explain what to do in the case of a major injury. So very worthwhile to have in your sessions. Think about this. You don't want to be caught out. Subscribe if you want to see more. I will be making more videos similar to this. Leave any comments if you've had a similar experience and how you dealt with it and what worked and what didn't work. I'd be actually really interested to hear that as well. Train safe, coach smart, and I'll see you on the next one, guys.